Hello, good evening, and welcome to Cafdil Healthcare here on Cafdil Television. We are live on all our social media handles: Facebook, Cafdil Cape Coast, and also YouTube, Cafdil EDU. My name is Kojo Arthur. Let me ask you one question. What myth about dental care are you curious about? I know you are thinking about it. There are quite a few misconceptions people have when it comes to oral health. And that is exactly what we are going to debunk this evening here on Cafdil Television. My guests are seated, but before I introduce them, take a look.
Fact or myth? Expensive toothpastes are always better than cheaper ones. Myth. Different toothpastes are better for different teeth and situations. Sometimes moderately priced toothpaste can be more effective. Ask the dentist about what might be best for your teeth, and always look for the ADA seal of approval. Fact or myth? If a tooth is white, it must be healthy. Myth. Under the surface, there may be cavities, problems with the root, or other abnormalities. Fact or myth? Teeth whitening is harmful because it damages enamel. Myth. There are many modern teeth whitening processes that have minimal harmful effects. Teeth whitening isn't for every mouth or person, though. Consult the dentist before you proceed with whitening treatments. Fact or myth? Dentists should be feared. Myth. With today's advancements in technology and safety practices, there's nothing to worry about. Procedures are as quick and painless as ever. Fact or myth? You should visit your dentist at least twice a year. Fact.
Welcome back. If you just join us, this is Cafdil Healthcare here on Cafdil Television. Today we are talking about dental myth. And to help me dive into this, Sarkodie John Oscar, he is a dental therapist, Cape Coast Teaching Hospital. You are welcome.
Thank you, sir.
And also Ebenezer Sefa is also a dental therapist, Cape Coast Teaching Hospital. Eben, you are welcome.
Thank you.
Oh, good to have you.
Welcome.
Like I said, dental myth, which means there are misconceptions when it comes to dental health or oral health.
Yes, please.
But first of all, let me ask Sarkodie, when we say dental myth, what exactly is it?
Okay, thanks for your question. Dental myths are basically practices, or it's either practices or actions that are carried on in a specific geographical location, that according to the people in that specific geographical location, they are true, but when you assess it scientifically, they are untrue or they are false. Thank you.
Okay, that is what people
believe
that
that is the cause, or that is it.
Okay.
But when you assess it scientifically, you get to know it lack scientific understanding or a scientific support.
Which means whatever they say, when you take it scientifically, it doesn't have any support or any effect.
Yes, please.
Oh, okay. So, let me come to this. What are some common myths people believe, about brushing and mouth washing? Because that is what we normally do. And how do they affect oral health?
Thank you very much. So people believe that brushing with a hard bristle toothbrush will be able to clean their teeth and they are more effective. So people think that brushing with a hard bristle toothbrush will be able to take off all the debris from their teeth and make their teeth whiter. But that's not true. The bristle of a toothbrush shouldn't be hard. So we recommend that the bristle of a toothbrush should be medium. And then the brushing, even how you brush. So the purpose of the brushing is not just to make your teeth white, but also to remove the debris and the food that you ate. So using a hard bristle toothbrush will rather cause a wear to a tooth surface. So some people, you will see that between the tooth and the gum, there's some depression, there's a wear because of the tooth, the bristle of the toothbrush that they use, and then the force they apply. The purpose is that they want to have a whiter teeth. You get it? But that's not the case. There's a technique of toothbrushing, and then the bristle, the type of bristle that you should use when you're brushing your teeth. So the myth of using a harder bristle toothbrush, usually recommended for smokers. So there are some toothbrushes you could see it's written on it smokers, which is very hard. So using a hard bristle toothbrush will rather cause a wear on the tooth, and later on you will have some sensitivity, you have some pain, and that tooth will definitely come out. So it's not as advisable to use a hard bristle toothbrush to brush your teeth.
Oh, okay. This is the first time of hearing this toothbrush written for smokers.
Yes.
I've never come across certain. And you also made mention of technique in brushing. I want you to take us through what are the technique.
Okay, thank you. There are basically numerous techniques that are recommended. But first of all, we mostly advise the best technique is what the client or the patient is comfortable doing, and he finds it very easy doing it. Because at the end, if you are able to demonstrate a technique that the client or the patient is having difficult to adapt, it means virtually he's going back to his old route. So usually you can see the horizontal and vertical way of brushing. They position the teeth just straight on the teeth, then up and down movement. Yes, that is what mostly we see our parents, we see our relatives doing. So basically that is the technique. Everyone,
I mean the horizontal, this one.
Yes, and then the vertical, so up and down, no. So that is, as my brother said, the cause of the cervical wear. We call it cervical abrasion. Yes, the brush gradually a depression, and it will reach a stage. The enamel will be eroded, exposing the dentine. So it will expose you to sensitivity. Sometimes it can even go deeper into the pulp. So all what we advise that instead of the horizontal and vertical movement, we advise that we go circular motion. Instead of the up and down, we position the brush 45 degrees to the teeth surface, then you go gently, circular motion, not the up and down pressure.
Let me just add to what he's saying. When you are used to the horizontal and the vertical way, going to the circular motion, in the initial, on the first stage, it's quite uncomfortable because you are not used to that. And you might think that going the circular way will not be effective enough because you are used to going the horizontal, the anterior posterior, very hard way. So going the circular way, some people would do it
anterior posterior,
like going vertical, horizontal. Okay. It's just another term that I used. Sorry. So when you go that circular, in the initial stage, because you are changing from what you are used to and coming to what is the best for you, in the initial way, you might think that it's not that effective. So some people will advise them that yes, when you start in that technique, in the initial way, you might feel that you even didn't brush after you are done, because you will see that, what kind of brushing that I did? I didn't do much. I wasn't able to go hard, but that's not the way. You go circular, you even brush it down, you go circular, you brush it down, you go circular. If we had a model here, we would have shown you how it is done. So you go circular, you brush it down, go circular. You go into the inner parts, you go into the surface that you used to chew, the surface that you chew. Some people, they brush just the outer surface, the inner surface, and the chewing surface, they don't brush.
It.
So you go the outer, you go the inner, and then the chewing surface too, you brush the chewing surface too.
Yes, I saw some picture here. I want you to, the inner, the chewing, whatever, where is it exactly located? I don't know whether you have it here. If this is all the...
I don't know if you can.
No. So when you open your mouth,
so
which part are you talking about?
Using this as a model, this is the occlusal surface or the chewing surface. This is what we use for chewing, grinding of this is the surface we use for grinding. So people brush this surface, they brush the surface closer to the tongue, and then they leave these surfaces, the depressions, we call it pit and fissures. They leave those surfaces. That's why he's advising that when you are brushing, you should also make sure you clean those surfaces. They are very essential because that's where it's a depression, so it's easily for food to accumulate. That is basically the cause, the initial cause of caries. That's what it starts. So if you just clean the teeth, you clean the sideways, you clean the inner, and then you forget to clean the occlusal surface, it's not advisable. Yes, please.
Oh, okay. Then again, you also made mention. Let me come to. Let's stay a bit on that because
Okay.
I'm very curious.
Yeah.
When it comes to the toothbrush that we use, you said we have the harder one.
Hard Bristol.
Okay, what is used by those who?
It's usually recommended. The reason for it being recommended to smokers is that the smoking, there are some stains that are being left around the tooth surfaces.
Because nicotine stains.
Nicotine stains, and they are difficult to remove them with a normal, medium, or short Bristol. So usually they recommend it for them, but for a shorter period.
Once
Okay.
the correction is
When
made,
the correction is
stop
made,
using
then they stop using it. Because how frequent you use it can also cause a wear to the tooth surface or the gum.
All right.
Yes.
So
Yes.
brushing your teeth circular, but when you get to the corner there, how is it going to be effective?
Yes, that is why we are saying when you are brushing your teeth, the usual time for brushing is not the 1 minute or 2 minutes. It's within 3 to 5 minutes, and we are not positioning the brush straight on the teeth, 45 degrees Celsius. So you angulate
So something
it.
like this, you angulate
You
it.
angulate it. So you have to open widely so that you're not targeting two surfaces at a go. You're not targeting the up and down at the same time. If it's upper, if you are starting with the upper, you should always target the upper posterior teeth. Then you come anterior. Then you go to the other adjacent surfaces. Then you come down. So you are not putting your teeth together. Then you are brushing. No, that's
Right.
not
So
recommended.
within a period like morning,
Yes,
how
please.
many times are you supposed to brush?
In the morning, the first thing you do after your prayers or up from the bed is to brush once in the morning. Then in the evening, that's the last thing you have
That
to
you
do
do.
before bed. That is evening. But in the course of afternoon, maybe due to the nature of your work, you went for night and then you are back. Maybe you have a short, maybe an hour or 2 hours sleep. When you are up, you can brush.
I asked this question because I've also heard that when you paste after brushing, first you rinse your mouth, then
mouth.
you brush again at the same period. That's why I asked.
For the brushing process, there's no scientific justification as to you brushing, cleaning your teeth, or cleaning the toothpaste and then brushing again.
So what was the idea behind doing that?
That's exactly why I'm asking.
Yes,
Oh,
there's
okay.
no. Once it's been done, that's why we say the usual time should be 3 to 5 minutes. Just relax. You shouldn't be. Maybe you are in a queue like bathhouse, you are in a queue, and then you are. No, we don't advise that. That's why we advise it should be the first thing you do in the morning. So there's no pressure on you. There's no phone call. There's nothing. So you can effectively brush all the tooth surfaces. And then when you are done, you bring your tongue out. People also forget to clean the tongue.
Yeah.
You have to bring your tongue out. You clean your tongue gently. Then you rinse your mouth. And another thing with regards to the question was about mouthwash.
Yes.
People also have a perception that mouthwash is a substitute for toothbrushing. And that is not true. Mouthwash has its own ingredient that is used for specific purposes. And it's different from the ingredients we find in our local made toothpaste. So it's two different things on its own. So please, if you have a toothpaste, that does not mean maybe in the evening you are not brushing your teeth. You just apply the mouthwash for like few minutes, you pour it out and go. No.
So
That's not
you said it has different.
Yes.
So what does it do?
For
really?
our unit, the most common ones we prescribe is the Camaclos or the chlorhexidine gluconate. Mostly it's used for gum infections. We call it periodontal diseases. Yes, depending on the extent of the damage or the extent of the infection. That's why we prescribe the mouthwash for you. And then we are not going to use it. We are using the mouthwash for a specific period of time, at most 2 weeks, because scientifically we have been able to research that too much use of even mouthwash can lead to teeth discoloration, can even alter your taste. Or another finding currently has also got to know that even oral cancers,
It can expose you to
oral
cancers.
cancers can be as a result of frequent use of some mouthwashes, because some of the ingredient or the chemical composition of the mouthwash, some of these chemicals are harmful to the bacteria or the normal oral flora. So it can predispose you to oral cancer. So mouthwash should be something prescribed by a clinician,
Yeah.
not that I'm in pain or I think I have to buy this so that in the evening I don't need to brush again.
So some people use it as a substitute for their brush because it's too easy. I think it's too easy for them. Just pour something in your mouth, rinse a
just be
little,
making cold white
then a
in
few
your mouth
minutes you are
and then-
done. But brushing, some people think it takes much of their time. But using a mouthwash is so quick and easy, you are gone. But nah,
So brushing should take 3 to 5 minutes.
Yes.
So anything below 3 minutes is not proper.
For effective brushing of all the teeth surfaces, as I said, up, anterior, you go back to posterior, the lower, posterior, anterior, another posterior. Then all the surfaces I showed you, plus the tongue, advisable to be 3 to 5 minutes.
Okay, so there is a myth that sugar is the only cause of cavities, but I am sure there are some lesser known things that causes this. What are those things?
Okay, thanks for your question once again. Sugar is a principal cause of cavities, or in our sector we call it dental caries. That is a dental word or the scientific word for it. But apart from the sugar, there are other causes. Sugar alone cannot lead to cavity. You know that the cavity should be, the teeth should be in a living human being's mouth.
But,
So-
I will not cut you, but for the purposes of my viewers, I want you to explain what cavity is, so
Yes.
they will know what
Yes,
exactly
yes,
you're
yes.
talking about.
Okay, cavity is what in our local settings we call it a two or kaka
Okay.
in the teeth. That is a local term for it. You are in the central region, so if you say a two, but in other local dialect, say kaka.
Here, I think we also know kaka.
Kaka.
A two, I haven't heard a two.
Yeah, a two means like hole in
Hole.
the teeth. That's why when they come, they compare that a
A
two.
two.
Yeah,
A two,
yeah,
oh,
it's a hole in the
it's
teeth.
a two is the hole.
Oh,
But
okay.
we other you also call it kaka.
Kaka. Okay.
Yes, please.
Yeah.
Yes. So apart from the cavity, apart from the sugar, there must be microorganisms. These microorganisms are naturally in our mouth. They are there for a specific purpose. There are millions of them. But one of their aspects is they are opportunistic. So they are there for a very good purpose. But once there is an issue or once there is a slight change, these same microorganisms that are very helpful will turn again to be harmful. So apart from the cavity, apart from the sugar, there must be microorganisms in the mouth. Apart from the microorganism, there must be also a susceptible tooth surface, or the way the morphology of the teeth must be able to accommodate the microorganisms and the food deposit. That's what I said when I was doing the demonstration of toothbrushing. I made mention of the occlusal surface.
Can you
So-
repeat that?
These are the occlusal surfaces. These are the surfaces that are used for chewing. And God, in His own wisdom, made it very broad. And then there's a depression, pit and fissures. So once we eat, it's easy for food remains to be stuck in between there, because naturally there are wider surfaces and there is a depression. So food easily lodges over there. And then there are microorganisms. And then, as I said, the sugar is there, the microorganisms are there, and the teeth surface, the way God made it, also makes it easier for the food remains to stack over there. So what is that? Is that once the food is left, the microorganisms are there, as I said, the opportunity to they take advantage of the food remainings and then convert it to an acid. Especially, we call them lactic acid. So what this acid does, it leads to demineralization, or that is what the cavity progression is setting. So initially, the caca or the tooth start as just a minute, you can see a minute cavity or a minute deposit on the teeth surface. You left it unattended because there's no symptom. And the teeth naturally is in layers. What we see outside is the enamel. After the enamel, we have the dentine before it progresses to the pulp. So the cavity starts, the enamel, sometimes asymptomatic. It means there's no symptom, there's no pain, there's nothing. Sometimes you see that once you are brushing or we look through the mirror, you can see that there's a depression, but once it's not giving me pain, let me forget. As time goes on, it needs time. So one of the factors for caries is also time, because it's not an event. It takes time. So as time goes on and is left unattended to, it progresses from the enamel, it progresses to dentine. So once it gets to dentine, sometimes there'll be sensitivity, sometimes even a sharp pain, but you know our system, you still left it unattended to. Then from the dentine, because the dentine is quite softer as compared to the enamel, it moves to the pulp. Once it moves to the pulp is more of that supplies the teeth with nutrients. So you know, as it's more of sensitive. So once it gets to the pulp, the pain starts. Sometimes it's on and off pain. Sometimes even a pain that you can use some local medications or some painkillers to control. But even it can progress to the surrounding tissues. Some people even present with swelling. So if all these stages is left unattended to, then the pain, sleeplessness, to sometimes there will be no some even resort to tramadol, some even use acid from the car batteries. You know the car batteries contain acid.
Yes.
Because of the pain, they advise them they should pour that acid and pour into their mouth or put into the cavity so it can help control the pain. But all leads to nothing. Surely they have to.
Is it not too dangerous?
It's dangerous, but
I will even cut him off. Yesterday, we were seeing a patient. Okay. So a lady came. I looked into the mouth and I saw a cavity. Okay. And she was in a little pain. So I asked her, how long has this cavity been there? I said, for long. And even when she was child. That the mother put some petrol. The mother dropped some petrol in it. And it was able to calm the nerves and the pain disappeared. So she didn't feel any pain again. I think the reason is that because of the chemical content or whatever of the petrol and those things, they're able to numb the nerve. So the nerve become inactive. Okay. So it's the nerve that is responding to whatever. That's making you feel the pain. So if you are able to numb the nerve, then they feel that whatever they put in there has been able to solve the issue for them. So that's why people resort to those things. But it will get to a stage that the nerve become necrotic. When we say necrotic, means that the nerve is dead. It's bringing out pus, which is some fluid and stuff, which they will accumulate. There are some spaces beneath this side. Okay, so those spaces, the pus will find, or the fluids will find their way into that spaces, and that will present as swelling. So they will come with severe swelling, sometimes all over the side. If it's the upper teeth, all over the face. It can progress even to the chest, to the neck, that even your airway will be blocked. You can't even breathe. And the final thing is that it can take away your life. Yes. So a tooth can take away, a single tooth can take away your life.
And then you go and remove it.
Yes, that's why in all my presentation I made mention of if it's left unattended to.
You go and remove it.
You know the perception, that's why we are here to eradicate that myth. Yes, that sometimes these things, it will reach a stage they will tell you this kind of infection, we don't go to the hospital with it, or we don't use a scalp, we don't cut. They call some as nepompo.
Yes.
See, emphasis kind
Anchor.
You get it. And by the time they report to the emergency, sometimes even breathing becomes difficult. And some lose their life as a result of this simple thing.
This is one of the reasons why people don't, go to the dentist unless they have pain or swelling.
Yes. Unless they have severe pain. Okay, so early prevention, early detection and prevention is very, very important. Okay. Our health, I think we should be very, very cautious about our health. The oral cavity or the teeth is as important as the whole body, because the health of your mouth has a correlation with the health of your whole body.
General body.
You get it? So you can't do away with the health of your mouth. If you have poor oral hygiene, or if you have a caries or a severe pain or whatever, what you are supposed to do in a day, you will not be able to do. It affects all your work. You will not be productive in a day. So you can't do away with your oral health. And then just if some people, when let's say they have a stomach ache, they have an eye problem and other issue, the way they are quick to respond to go to any facility to be seen, it's not as same as their teeth, because they think their teeth,
you have 32 in number.
32 there, what was it?
Yes.
Okay, so it's very important.
32. I mean,
yes.
32
yes. A little top up to what my brother also said. As we know, the mouth is the gateway to the body. Apart from that, sometimes even some systemic conditions, such as now the usual retro or the HIV we know, sometimes there could be some manifestations in your mouth that will prompt your dentist to tell you that this is this condition that is developing in your system, or this is you're about to get. So frequent visits also help us to also, not only with regards to dental, but there could be some systemic condition that is yet to be, or it has started in your system, and we could easily rectify you to go and see your physician, so that early management advices or medication or some treatment could be melted out, so that it doesn't progress to be worse. So if you see any changes in your mouth, not only, you shouldn't wait till there is so much pain that you couldn't even sleep before you visit the dentist. If you see any color change, any swelling, anything, just visit your dentist. It could be not only related to it, it could be maybe as a manifestation of some other disease. That early treatment could help save your life. Thank you.
If you just tune in, this is Cafdil Healthcare here on Cafdil Television, and we are discussing dental myth. There are so many misconceptions that you and I, we have about this, and I hope they've started debunking some of them. I'm happy to hear most of them. I know you are also learning. Continue to follow us on our social media handles, Facebook and also on YouTube. Some also say that the color of your eye is same as the color of your teeth. How true is it?
Yes, I've heard it before, but that's not true. What mostly we collate it to the teeth color is your skin color. Your skin color and your teeth color usually matches.
But
yes, but
Eben is dark.
Yes,
But
not matching as they being the same color.
Okay.
You get it? It's like saying black and white matches, not like they're the same color, but the way your teeth,
The
people
two
with
colors
the
complement
same skin
each
color
other.
usually have that a peculiar teeth color. You get it? Like a shade of teeth. So black people have a peculiar shade of teeth. People fair or people with different skin color also have a peculiar shade of teeth. Yes. So the correlation is between your skin color and your teeth, but not your eye.
Your eye.
Please.
Anyway.
Thank you.
But ever since I heard them, normally if I want to know the color of your teeth, I look into your eyes.
Yes,
And sometimes
right.
when you laugh, I
Yes.
compare.
That's
You
what
see that?
mostly, if someone has done bleaching of the skin or bleaching of the teeth before, or like that now, what they simply put it as whitening of the teeth. Any clinician, once the person smile, your teeth color and your skin color, sometimes it flashes like no, it doesn't match.
Okay.
You can easily deduce that this person has either temper with the skin or he has temper with the teeth.
All right.
Yes, please.
Okay. Is it? We also have people who have this bad breath,
Yes.
and normally we associate it with food. Is it true that this bad breath is only caused by food, and what are the underlying causes?
Yes, thank you. Bad breath, there's a numerous cause. Even with regards to dental, not all bad breath or what mostly we term it as halitosis is caused by dental causes or from oral sources. Other infections, even in the body, can predispose you to halitosis, such as sinusitis, such as even chest pain, sometimes periodic coldness. There are so many that can cause, because you know the oral cavity has a link with the nasal cavity. So when there is even a flu or running nose, sometimes it can even predispose you to bad breath, sinusitis, chest pains. There are so many connections with other body parts that comes in contact with the oral cavity. You get me? So it's not only, but according to research, more than 80 to 90% of the cause is from oral. But that does not mean the other 10%, we don't really need to talk about it. Yes. So mostly all the causes of halitosis, as I said, 80, 90 is from dental. And it's not only from food. The issue is even all these effects, some of these dental conditions I have mentioned earlier, like normal caca, you are in pain. So ask yourself, how effectively can you even brush that teeth surface?
Aside.
You get it? And once you're not able to brush your teeth, food deposit, they are microorganisms, as I said, they are opportunistic. So they produce this, sometimes the waste products of these microbials produce these offensive smells. You get it? So all what we are saying is, it's not only food. Sometimes you can eat some food that contain garlic, some food that contain onion. That one we don't call it. It's just a transit, just a short period of time, and it's gone. But there are some halitosis. It's not really a short period of time. All the time, you can experience these conditions. So all what we say, once you feel the issue is halitosis is very difficult to treat because even who is going to alert you that you have this condition?
That
you
is
get it.
That is it.
Yes,
Everybody is afraid to tell you
yes,
that it is.
yes. So it becomes very difficult to treat, and sometimes they don't have, but due to what maybe their relatives or their friends, their reactions they are receiving from them, they think or they perceive that, oh, then I have offensive, because maybe when they are talking to their friends, maybe they just want to give them some distance or some facial expression so that no, it seems maybe
but some of them are also aware of it.
Yes, some are aware.
Yeah.
That's that one. We have the objective, you have the subjective, and you have the psychogenic. The psychogenic, they have it in their mind. For the objective ones, they themselves, they know it. And sometimes to maybe their close relatives, friends, husbands, wives will notify them, or mothers will notify them, then they come. Yes, some are able to come, but it will reach a stage that they themselves, they might not know. And sometimes their relatives also feel shy, or might find it very difficult to tell them. It really makes management of it very difficult because the person is not told, but the person is having the condition. So who is going to advise the person to visit the dentist for management? You get it? So it becomes very difficult. That's why we advise that every 6 months you have to visit your dentist. Whether you have any issue, whether you have pain, whatever your condition is, just visit the dentist. Once periodic investigation, periodic examination is done, the dentist will be the best person to be able to determine that this is what you need. You get it? So that
at least twice a year.
Twice a year.
Twice a year.
If you see, when to me cry there, at least once in a year, make it.
Is it free?
With regards to Cape Coast Teaching Hospital, once you are coming for examination, if you are having insurance, it's covered. But the treatment you are coming to, the treatment that will be done, will determine whether the insurance will pay part, and then you have to top up with something. Yes, but for re-examining you without doing anything, that one, insurance, if only you have insurance, even some of the private insurance too is free.
Yeah. So let me add a little to what all that he has said. So with regards to bad breath, like he was saying, about 80 to 90% of it is from the mouth, and there are other factors too, or other causes too. Sometimes some people report, you could see that when you assess or when you examine the mouth, you can't see anything there, but they still feel that no, they have a bad breath. You can approach them, get closer to them, and try to have some feel of it. And still, so such people, we try to counsel them, talk to them, and then we do a cleaning for them, a scaling and polishing, that professional treatment that we do. And then we advise them and we talk to them. So sometimes it's just about, like he was saying, a psychological thing. There's nothing there, but maybe he feels that when he relates with friends or colleagues, they withdraw from him because of maybe when he talks, he thinks that they think he's smelling bad from the mouth. So most of it is more of psychological issue that we talk to them, we counsel them, and they're able to overcome it.
So what is calculus, and does it develop naturally?
Okay, so before we get to calculus, or before calculus develops, there's something we call pellicle. Okay, so there's saliva in our mouth. So even after brushing, this saliva deposits around the tooth. Bacteria in our mouth. The bacteria are the bacteria for a purpose, not to harm us, but they become opportunistic, like he said, when the environment favors them. Okay, so these bacteria deposit on the saliva. So when you brush or when you wake up in the morning, when you apply your hand at the anterior part of your teeth, you could feel some slimy substance. Okay, so that's the pellicle that forms around the tooth. So whilst you eat and your oral hygiene is not good enough, you are not brushing when you go to bed, you are eating. So these food particles also deposit around the pellicle and the bacteria in it. So the bacteria will feed on that pellicle. Okay, so the bacteria deposit around the pellicle and depositing around the tooth. Okay, so they start to react, produce this acid and these chemicals, and their remnants on the gum and in the tooth. Okay, so they cause the body starts also to like counter what the bacteria is trying to do to cause harm to the gum or to the tooth, and that initially comes as inflammation. So you could see some redness around the tooth, what we call gingivitis. Now you see that when you brush, there will be some bleeding. You'll be bleeding when you brush, which it shouldn't be so. You're brushing, you shouldn't be bleeding from your brushing. So meaning that there's some inflammation that is going on. So whilst your oral hygiene is not good enough, these bacteria continue with some chemicals like some calcium and phosphate and other things which are deposited. So it becomes very hard. So initially with the dental plug, you can't see anything. Okay, but when there's much deposit of this calcium and this phosphate, it becomes very hard that you can feel it you can see it in your mouth, in between your teeth, some yellowish to brownish color, which you can see. Brushing with toothbrush will not be able to take them off. So that's when the calculus is formed. So it has become calcified, it becomes hard, that even using the normal toothbrush to clear them is not able to go. You get it? And it causes on to damage the gum and the tooth. So you will find out that now the gum, which was initially attached to the tooth, become loosened. Okay, now you brush, you are bleeding. Now the depth of the gum between the gum and the tooth becomes widened and deeper. Okay.
So that's where the blood will.
Yes. Meaning that there's a disease that's ongoing on, or that's going on beneath the gum. Okay. So whilst your oral hygiene is not good enough and you are giving it enough time, you could see that now the tooth becomes a little mobile. The tooth becomes a little more. There's no cavity. You won't see any obvious cavity in the tooth. But you could see a synaphydia, a shaky. The tooth has become mobile. Sometimes the tooth even comes off themselves without even coming to the dental clinic for us to take it out. And all is caused by the calculus. So we remove all these calculus from the tooth, from the gum.
How long does it take to form or to harden?
Basically, after eating, just as he said, that the plaque formation setting, as time progresses, few days up to a week, the saliva contains, as he says, calcium. So the calcium in the saliva plus the food remains, it makes it very hard. Calcified. So they are mostly in between where the two teeth meet. That space is in between, because those spaces are very difficult to be reached when you are brushing your teeth. You get it? And even if you are eating, there's no way those accumulations in between the teeth could be brushed or could be in a way. So they are mostly formed in between the teeth, spaces that are very difficult to even reach when you brush your teeth. So the calculus, it doesn't mean you can even brush twice, but still the calculus will form, because not all the surfaces of the teeth can be brushed or can be cleaned when you brush your teeth. So whether you brush twice or you brush thrice a day, still the calculus, there are some surfaces they will form, because that's how naturally God made the teeth. Not all the structures, not all the surfaces can be reached. So you have to come to us. Then you do periodic cleaning. That's why we say periodic. It's not like once in your lifetime. It should be periodic. Yes. And what my brother was saying, this is the gum. After the gum, there are structures. Or what the gum and the periodontal structures does is that they hold the teeth firmly in position. So once the infection starts with the gum, if it's left untreated, it goes beneath to periodontal ligament, to the cementum, and then it goes to the alveolar bone. So these structures held the teeth firmly in position. So once the infection sets in, it reduces their strength to hold the teeth firmly. So that's why I'm saying there will be no cavity in the teeth, but as the infection goes on, the strength of the supporting and the surrounding structures to hold the teeth loosen. So the teeth becomes mobile. So there will be no cavity, there will be nothing but the strength.
But you see,
and sometimes to even
I think this picture can even explain more.
The gum level also recedes. We call it a gingival recession. So you can see even part of the root of the teeth exposed. All denotes that periodontal disease is going on. So you need to periodically visit your dentist.
All right. So let's see this picture. Can you see this tooth? So this is the enamel, this is the cementum, that's the roots. Okay. So the gum, these are supporting tissues, okay, which is supporting the tooth. Now a diseased tooth, this gingivitis, you could see the color of the gingiva. It has changed a little, okay. And now there's a deposit here. Can you see some deposit around? Small. That's the calculus. Deposit around the cervical area of the tooth, okay. So it's causing a wear and a degradation of the gum tissue or the supporting tissue, okay. So we get to a stage that will change from the gingivitis to periodontitis, meaning that the supporting tissues of the tooth
Has also been
has also been affected. So you could see the gum level, it was here.
Yes.
Now, have you seen where it is now?
Yes, there's a recession.
It has receded.
Seeded.
Okay, has receded to a level that now the tooth, the support of the tooth is weakened.
Okay, you get it.
Now the tooth become mobile
You can just even use your hand
to pick it up.
So that is it.
So even if this teeth goes out,
Yes.
there wouldn't be any replacement.
No, please. If
Just as children.
No, if it's a primary teeth, there's a possibility that's it. Yeah. But that one, unless he visits it's not, the treatment is not done at home. You have to visit the dentist. He will let you take an X-ray for you to determine. Because if this condition is supposed to go on, even if the primary teeth is out, the permanent teeth comes in. Because you didn't seek early management, the permanent teeth will also experience the same issue, and then with no time, you also lose the permanent teeth.
Yeah.
Yes.
With a plug, I've seen a parent using cutlass in removing them.
Yes,
before.
yes. It's not only cut. Some even use.
They do a lot of things.
Some use blade. Some use very sharp object.
Did I say cutlass? No, knife.
Knife.
The small one.
Yes, I've seen
The
that.
cutlass is the one.
I think
we
that's
use.
the reason people use a hard brushy toothbrush.
Toothbrush
Yeah.
to thinking they can
Get rid of them.
But you can't get rid of
No.
it.
That's why I say it's calcified.
It's very hard.
And where they are positioned, it's in between. If it's on the teeth, sometimes, but if it's in between the teeth, that's where the gum is also. So if you mistakenly, you might hurt your gum, and it will lead to bleeding and other stuff.
This thing, I don't really know the name. It's just like a string or that people use to remove those things.
Is it dental floss?
Maybe it could be.
Is it a thread?
A thread?
Yeah,
Yes,
floss.
a small one.
Yes.
Is-
Some come with a handle. Then
yes.
yes.
Is it good to use that?
It's advisable. If it's dental floss, not any toothpick or anything. Dental floss is recommended, but not any toothpick. You use in between your teeth.
So the toothpick that we've been using is not good.
It's not recommended.
Oh,
Yes,
really?
It's not good.
I have full box in my room. That's what I've been
That's
using.
why we are advising on the use of
Oh, then I'm
dental
going
floss.
to throw them away.
Yes, try buy the dental floss rather.
Okay.
So that there's maybe
May rather be
weekends-
causing injury to your
Injury to
gum
your
whilst you are trying to take
Yes.
anything off from in between
Yes.
your teeth. So if you use the floss is able to go in between
the gum.
the teeth and the gum to bring out whatever
And the
that is locked in
deposits,
there.
yes.
You get it? Yeah.
So which one? This one creates a lot of spaces there.
The
It
The
opens
pick.
the
yes,
space between
yes.
them.
Yeah.
And the issue is we don't know the source of the pick, whether it's sterile, so we don't know what you are even introducing. over
That
there.
is true.
You get it.
That is.
Yes,
But
yes.
let's come to the mobility, tooth mobility. Is it associated with aging?
Yes, it's a great question because most of the cause of the teeth mobility, as we discussed earlier, is the perio. The perio, as I said, we discussed that from the gingivitis, if left untreated, it leads to the perio. By the time we treat perio, virtually the teeth is either grade 2 or grade 3 mobility. Meaning some of them, you can just use your hand to move
So,
it
yes.
up and down. Yes. So people think it's related to aging because, as I said, all these dental conditions, they take time. You get me? They take time before the effects, or it progresses to that limit. So it's sometimes very uncommon to find it in young children, but it doesn't mean it does not happen. But mostly when you get adult, by the time they reach 20, 30, if they still practice the old or the poor oral hygiene practices, they still adhere to it. Surely by 20, by 30, their teeth will start coming out. Either becoming mobile. And once it becomes mobile to some limit or some degree, it means no dental treatment can be done apart from extracting.
And I've seen that when it get to a certain level that you want the teeth to come out early, they use salt. They put in salt there.
Yes.
I've
The issue
seen a
is
lot.
that's why we are, once there's even mobility, the issue is we all forget that you have 32 teeth. And that condition, maybe there's only one teeth that is mobile. But there could be other teeth that they are although they are mobile, but not to that extent of the one you are having an issue with.
Yeah.
So if you visit the dentist, maybe after radiographs, you may be able to deduce the other remaining teeth, what maybe their level of mobility and what needs to be done, so that they will not also progress
to that
level.
level.
You get it? So that any preventive measure or any treatment can be adhered or can be melted out, so that the remaining teeth, you're not going to also have it extracted. Because they will come, it will reach and nothing can be done, we extract. 2 years time, they'll come for a different one. So by the time we are around 40 or 50, they're virtually all the teeth
are
are out. Yes, and once you report early, as we can say, the periodic cleaning, you advise you on it, you'll be doing it. So the possibility of the other remaining teeth getting it out or extracting it is what is less. Unless you yourself, the advice we gave you, you don't adhere to. If not, it's going to be only that teeth you came. Maybe that one, nothing can be done. But the remaining teeth, if you follow our advice and our education we give you, there's no way that remaining teeth will also relate.
You know, there's some adage that we share them and say, FFI. No, so we share them and say, etutu. So our mothers think that while they are taking care of us to have all our teeth present, they will get to a time that as they also grow, all their teeth will also go out.
Come out.
That's not 100% true. Okay. So a good oral hygiene, when you start from a youthful age, visiting a dental clinic for regular professional cleaning and taking care of your teeth, you can grow to a certain age and still have almost all your teeth present. Even if you've lost some, you'll be just few and has almost all of them present. Because I remember I saw a patient who is about 85 years and she has almost all the teeth present. And you could see her oral hygiene is very good. So though they undergo some hormonal changes, the immune system comes down a little, the body becomes a little weak and stuff. But if you practice a good oral hygiene from a youthful age, you can grow to a certain age and still have your teeth intact.
Some children are born with defect, like clefts. Are these cursed or spiritual babies?
Thanks for this question. The rare cause of some inborn errors or these birth defects, we call them idiopathic, meaning we find it very difficult to ascertain or to know the exact cause. But we have some predisposing factors that could lead to these children with these birth defects. Especially for cleft, we can make mention of medication, unprescribed medication. You know, mostly research shows that cleft is mostly developed in mothers, especially either that's their first pregnancy or maybe they are tender. Some of them, they even get pregnant without them knowing that they are pregnant. So the initial stages, they resort to maybe malaria treatment. They think they are vomiting and they are feeling feverish. Maybe it's our usual malaria. So they go to us. Now you can go to a drugstore and buy any. So they resort to other medications and other concoctions without them knowing the effect of what they are doing. It's not like they are intentionally do, but they don't know. Or for them, they are treating a visual malaria, which is maybe periodic or every few months they experience. They don't know that some of them don't even know that they are pregnant. So until maybe they visit the physician for them to run some labs and they are told that they are pregnant. So, and mostly there is the early stages, first trimester, and that's the formation of the body parts. You know, in those body parts, they don't form like all together. It's structures that come together to form. So if, let's say, the upper palate, structures from both left and right will join. So during those formation, when you take these medications, sometimes smoking, sometimes these drugs, sometimes these concoctions, instead of the structures fusing together, sometimes it fused, but some places are left without coming together. So that's why mostly you can see the cleft. If it's about the lip, you can see part of the lip are joined, part are also not together. If it's about the palate too, you can see part of the palate are joined together, but part are also exposed. Yes. So the exact cause is not known. Even some are also attributing it to genetics or maybe hereditary, because there are some, maybe their grandfathers used to came with this cleft. They are not maybe spiritually or not cursed, not maybe their second wives, or maybe they think the first wife went to curse them, or but it does happen.
All right, our time is drawing closer, and let me take this last one, talking about orthodontic treatment, where we see people with braces, and they said they are for the rich and also for fashion purposes. How true are they? Do they wear, or why do they wear them?
Yeah, thanks for this question. Indeed, orthodontics are few in the system, and in our health, once they are few, surely the treatments. That's why the treatment is quite expensive. Let's be honest with you. So people have the notion that because they are few and their treatment are quite expensive, it's only limited to the rich. So it's like rich men or people with affluent background that can undergo the treatment. But it's there for a correction purpose, there for the alignment of teeth, or when the person put the teeth together, there's a space. That's it. So it's not. It's there. The orthodontist is there for everybody. So we shouldn't have a notion that this is maybe the rich treatment. No, there's nothing. They are there for a correction purpose, for whether my alignment. So your social class, once you can go there, talk to them, and the very good thing is some of them, although the treatment is expensive, they have ways of payment. Sometimes they can give you modalities to pay. Maybe you pay some, restart. As time goes on, you'll be paying them bit by bit. So they are not there, or it's not only meant for rich.
For
people.
the rich or
average,
whatever.
You can go and then.
So, but when they wear, how long does it take? Do they remove them?
Yes, please.
They remove them. How long does it take?
Yes, it depends. If you're able to go early, maybe if the treatment is even for 10, 11, sometimes at most 2 years, you have to wear it.
Okay.
But if you grow, maybe from 20 ago, your bones are already developed. So it takes time. If it's not like it's not corrected, it's done. But it takes time, maybe 3 to 4 years before we do. So
And they are regular visits too. So you'll be going
But
for review.
are they comfortable when they are eating?
yes, for the first time, as I said earlier on, it's the first time, so they are going to feel a little discomfort when they are chewing. But the orthodontist, is a very wonderful unit. They will advise you on mostly what to eat, so your expectations, and they are there for you. So once you have any difficulty, you can call in and then talk to them. They are very nice. Now in Tabetan, you have two very honorable orthodontists, Dr. Ayi and then Dr. Tano. They are there for you.
Yeah.
So once you have any issue with malalignment of teeth, any space you are not comfortable with, any arrangement of teeth that you yourself you feel that it's maybe hurting your self-esteem, you are not when you're social, you are not able to laugh effectively and efficiently, you can visit them.
All right.
And then it will be of great help.
All right, that's good to hear. Well, our time is up. Just 3 seconds, your last word.
So all that we are saying is that we are creating awareness on our oral health. Our oral health is very important. We can't do away with our oral health. So early intervention, early reports, and then possible treatment, so that you won't get to a worse stage that you, the patient, will go through a lot of pain and stuff. So you should visit the dental clinic as much as you can, at least twice within a year, for a checkup, and then whatever that we will assess and then inform you. We'll go about it to help you.
All right, Abidi.
Thank you. As my brother said, early treatment, early detection, it doesn't only relieve you of pain, but it also save money. Because if you compare the cost of if you are to extract your teeth and to replace and to do a replacement, as compared to you coming early and then we doing a filling for you, filling is around 200 Ghana. But if you wait and the teeth get deteriorate and you have to extract, after the extraction, even if you want to fix a permanent one for, let's say, a 3-unit bridge, it's around 5,000. So comparing initial visit of that costing around 200, that could end. You get it? That could help seal the cavity, as compared to it progressing, getting to the tissues and then causing a whole lot of pain and swelling. I think we should try and then do our best to report early, so that early treatment can be meted out. Thank you.
Thank you so much for coming. Thank you, Sarkodie, John, Oscar, and Ebenezer Sifa.
Thank you.
Dentist, dental therapist from Cape Coast Teaching Hospital. This is where time will allow us to be with you. My name is Kojo Arthur. Thanks for watching. Thanks to all the crew. Same time next week. Stay tuned.